The White House announced new goals for the U.S. vaccination program Tuesday. It comes as the administration ramps up efforts to reach Americans who are hesitant to get vaccinated. During a briefing earlier, President Biden said the administration is zeroing in on getting the shot to 3 groups of people.
In the next 2 months, our focus is going to be on 3 groups. Kids between 12 and 15 who are awaiting potential FDA authorization to get a shot. 2, adults who have had trouble locating a place to get a shot or who just haven't gotten around to it. And 3, those who need more convincing. As we turn to this new phase, we're also setting a new goal. 2 months from today, families across the country are going to celebrate the 4th of July. Our goal by July 4th is to have 70% of adult Americans with at least 1 shot and 160 million Americans fully vaccinated.
To help with accessibility, the U.S. is expected to start increasing walk-in appointments, pop-up clinics, and mobile units. Officials tell CBS News the Biden administration is also shifting its distribution plan to make leftover vaccine supply available between states. At least 25 states did not order all of the available doses allocated to them for this week. Dr. Bechara Choucair is the White House vaccinations coordinator and a member of the White House COVID response team and joins me now. Dr. Choucair, welcome. I want to start off by asking you about primary care physicians. A recent Kaiser Family Foundation poll found that half of people who would rather wait and see before getting vaccinated said they would be more likely to get the shot if it came from their primary care doctor. Yet just 38% of those physicians are administering the vaccine. Why weren't primary care doctors more involved in the initial rollout plan?
Well, Elaine, thank you so much for having me here. And it's a great day to launch the new goal that the president has set for us for the 70% of adults getting at least their first dose by July 4th. This is an important goal. And to your point, primary care doctors are going to have to play a significant role in making sure that we help get to that goal. And we have already had physicians involved in the vaccination efforts, but as we move into this next phase, and particularly for people who have questions, and a lot of people have legitimate questions, and they want to ask those questions and get answers to those questions from their doctors, the role of doctors become even more critical as we move into the next phase. And that's why we're stepping up our efforts to ensure that physicians who are already enrolled in the programs are getting vaccines. Those who aren't enrolled are actually getting enrolled, and we're working with the physician providers group, whether it's the AMA or the American Academy of Family Physicians or the American Academy of Pediatrics and others, to make sure that we're continuing to build on the role of physicians in this next phase of the campaign.
But I guess I'm wondering, Doctor, when it came to sort of the foundational planning of distributing these vaccines, why is it that these primary care doctors weren't more involved at that point?
Well, I have to say, Elaine, primary care doctors have been involved from the beginning, but maybe not at the pace and the scale that we need them to be involved now. Remember, in the first part, it was really about making sure that we have high throughput sites. We needed to vaccinate as many people as quickly as possible, obviously with keeping a very close eye on equity. Now that we're in a phase where we need to make sure that we're reaching those who are not so eager to get to be vaccinated and they're not willing to go and stand in community vaccination sites that does 6,000 shots a day or more, it becomes more important that we continue to engage family doctors and primary care providers in general. But from the get-go, I mean, I have to tell you, from the get-go, we've engaged hundreds of community health centers with lots of primary care doctors across the country to make vaccines available in communities that have been disproportionately impacted by the pandemic. We have doctors that are part of health systems across the country that have provided vaccinations in their offices. I think now it becomes even more important, and that's why we're really excited about this effort with the states, tribes, territories, and the provider groups to getting more and more docs to vaccinate in their offices.
I wonder, Dr. Choucair, with respect to the call that happens with the governors across the country every week on the coronavirus, the previous administration made it very clear that former Vice President Mike Pence was heavily involved in those calls. And there have been reports that Vice President Harris has been largely absent from those calls. What is her level of involvement with those? And can you give us a little bit more background and context for that?
Well, the vice president has joined one of these calls already, and I know she's actively engaged in the effort on the pandemic. She participates in briefings. She weighs in regularly. The reality is a lot of these calls on Tuesdays at 11, we have folks, we have the CDC director, we have Dr. Fauci, Jeff Zients, who's the coordinator for the response overall. We participate in those calls, and we have tons and tons of individual engagements with states, whether governors. I have lots of engagements with state health officers. So the engagement and the partnership between the federal government and the state government continues to be critical for us to be able to put this pandemic behind us. And I am so thrilled with the level of cooperation and partnership that we're seeing across the country.
On vaccine hesitancy, is there a point, Doctor, at which the White House will just accept that there may be limitations to its ability to combat vaccine hesitancy among all Americans?
Well, let me just start by saying, Elaine, that we know there are tens of millions more people who want to still get vaccinated, and they're eager to get vaccinated. So making sure that vaccines access is easy, is convenient, is going to be really, really important at this point. But also we know that there are people who have legitimate questions, and we have to be able to answer those questions for them. We have to be able to provide them with the facts so that they can make their informed decision. And we're going to have to continue to work on providing those answers to those folks so they can get vaccinated. And there are groups of folks who will not going to get vaccinated. We respect their decision. At the end of the day, getting vaccinated is an individual choice.
In our final minutes, Doctor, the FDA is expected to authorize Pfizer's vaccine for children aged 12 to 15 by next week. What more can you tell us about other vaccines besides just Pfizer? And is there a possibility kids younger than 12 will be eligible for vaccination soon?
Well, as you know, we are waiting on the FDA to make this decision. We all know the FDA is an independent entity that does, it really drives science. It's really focused on rigorous assessment of safety and efficacy. For now, the only application that's in front of the FDA is from Pfizer for 12 to 15 years old. We know there are more studies that are happening, and we'll wait and see what ends up making it to the FDA for full review by the FDA. But we are looking forward to the decision by the FDA on 12 to 15, and we stand ready to execute on a plan to make sure that the adolescents in this country are getting vaccinated should there is a decision to provide emergency use authorization for Pfizer.
Doctor, we have seen some heartbreaking images out of India, out of Brazil, other parts of the world where this pandemic is clearly ravaging populations. And the Biden administration is under pressure to share patents for COVID-19 vaccines so that developing countries could manufacture them. Is that something the administration is considering?
Look, well, the president has said from day one that this pandemic knows no border, and helping the world is the right thing. And from day one, we've re-engaged with the WHO. We've contributed more resources to COVAX than any other country in the world. And we continue to stand ready to support other countries in getting access to the vaccine. And as we build our confidence in the vaccine supply, we'll be making available about 60 million doses of the AstraZeneca vaccine for folks across the world. When it comes to the patents, I'll have to defer to other folks within the administration that are looking into this at this point.
And finally, Doctor, what is your message to Americans now as they look to the summer months, as they think about their children perhaps returning to classrooms in the fall, and wondering, with a mixture of anticipation and anxiety, what it is that is in store for the country?
Well, first of all, let me start by saying it's never been easier to get vaccinated in this country. So if you haven't gotten vaccinated yet, please get vaccinated. There are lots of places that are offering walk-up, no appointments needed. You can text your zip code to get vax or to vacuna and get 3 locations within your zip code or near you that you can get vaccinated in. You can look up vaccines.gov, you can look up vacunas.gov and try to get locations where you can get vaccinated. But equally as important, once you get vaccinated, please take a moment and find folks that you know, your friends, your family, your neighbors who haven't gotten vaccinated yet, and engage with them in a conversation. If they need assistance in scheduling an appointment, please offer them help. If they need assistance to getting to an appointment, please offer them help. At the end of the day, the more people get vaccinated, the faster people get vaccinated, the closer we make or we inch towards the president goal of 70% of adults getting at least 1 dose by July 4th, the more likely we are to be able to put this pandemic behind us.
Dr. Bechara Choucair, doctor, thank you very much for your time.
Thank you so much for having me, Elaine.